In this module, we will talk about the prerequisites of social case work, what kind of the technicalities and prerequisites are required for a professional social case worker. First of all, a professional social case worker is a change agent, which means that when we say that a case worker is a change agent, which means that a case worker should have a sufficient knowledge about the social processes, the social institutions, the concept of development and the learning pedagogies, so he can motivate the people, and he should, with having the sufficient knowledge, he should be able to convince the masses and as well as the individuals in the form of the client who seeks help from the case worker, that the case worker can bring a positive, constructive change in the behavior patterns of the individual and in the normative patterns of the community because of those problems existing in the normative patterns of the communities. The individuals are facing the difficulties and the problems, and which are creating the issues for the individuals, and to create a change in the attitudes of the family members, which can be helpful for the individuals to recope with their life situations. So a social case worker is a change agent who can bring a positive, constructive, healthy change. Similarly, a social case worker must be a person who is capable of changing himself, because a case worker is accepting the different people who are suffering from the different situations. So a case worker should be open to accept the diversity, should accept the different people, different situations, and he should be able to change his attitude as well to be in keeping with the values and principles of casework. A caseworker should be professional enough and should cultivate the professional ethics of the casework profession and the approaches, techniques, and principles of casework profession, and should not be stick to his personal priorities and personal likes, dislikes, and personal choices. And he must be open to new ideas and develop the capacity for self-awareness. So sometimes the individual who comes in the form of the client comes with the problems which is due to the change due to modern technology and the change with the passage of time. So the caseworker should be able to accept these changes with open mind and should be equipped with all the skills to solve these problems. And this is possible only because of the self-awareness. And self-awareness should be present on the part of the caseworker, and self-awareness is to know about himself or herself as a professional caseworker. And self-awareness is not an ending process, it's a continuous process which continues from the beginning till end. And the ability for self-awareness is an essential quality in order to perceive and to know his own biases, his prejudices, which can be present on the part of the caseworker, and should be able to render effective casework services to the client. This is possible when the worker is well aware of his own weaknesses, flaws, his own biases and prejudices. A caseworker should also know and should be related to the belief in the basic assumption in casework is the necessity for the social caseworker to cultivate appropriate attitudes and qualities necessary for a social work profession. which means that a social caseworker should wear the costume of a professional caseworker. And by ignoring his own personal intentions and his personal tendencies, he should use the professional techniques, and he should be ready to accept the new emerging trends in the body of knowledge of social work profession. And if we see that the role of the caseworker, which can be the prerequisite for the social caseworker, an important role is the clinical behavioral change role, which means that the caseworker focuses his attention on those aspects of the client's behavior which cause stress to the client and which are responsible for the disturbing situation which the client is facing, and the client might not be aware that what kind of his hidden personality weaknesses or his hidden personality flaws are actually distorting the situation and is creating the problem and hurdle in the selection of the rational solution of the problem and understanding rationally understanding of the problem. So a caseworker should play the role of clinical behavioral change role for the client. Then another important role of the caseworker is the role of consultant and educator. The caseworker may be required to give consultation to other social workers as well, and the experts from other professionals and other departments and other disciplines as well. Even in social work, we see that, for example, like in social work complex, Social Welfare Training Institute, there are a lot of institutions are working in which the casework is required to be practiced, like Gehwara and like Aghosh and Darul Falah, Darul Aman, in which basically the social welfare officer is appointed as the principal of Social Welfare Training Institute, and they can seek the services of social caseworker in these institutional settings. So the social caseworker can work with them as educator or as a consultant. Another role of social caseworker is a role of advocate. The social caseworker work with the weaker sections of the society and the less privileged individuals of the society. When these marginalized individuals come to the client to seek help, then the caseworker can work as an advocate for them and can do lobby for them. For example, women who are the children who are suffering from child abuse, or women who are suffering from sexual harassment at workplace, the case and they're unable to speak about themselves on their own. So on their behalf, the caseworker can do advocacy and can do lobbying in the society, and on the basis of that, social legislation can also be done, like Workplace Harassment Act and like Child Protection Act. So as a broker, the social caseworker can inform about the other welfare services which are present in the society. For example, if a patient in casework sitting in medical social services project comes to the caseworker to seek help, and the particular disease of the patient is concerned with other hospital setting. So the caseworker can work as a broker and can guide to the family or to the patient to another hospital. For example, the patient in Jinnah Hospital can be referred, who is suffering from cancer, can be referred to Shaukat Khanam or can be referred to in Mole Hospital. Similarly, if an individual is in need of some monetary help, in need of some financial help, can be referred to Baitul Mal or Zakat department. So a caseworker performs dynamic role and multiple role to provide help to the client.